Intestinal rehabilitation is an effort on the part of many healthcare providers to help an individual who is suffering of severe injury or illness to their GI tract, to their gastrointestinal tract. It's an effort to help that person restore their ability to bring nutrition into their body to be able to feed themselves. Patients who are appropriate for intestinal rehabilitation are going to be individuals who suffer from an injury, surgical intervention involving the gastrointestinal tract, diseases that will affect their ability to bring nutrition into their bodies. Examples might include Crohn's disease, particularly individuals who've been through many operations, people who've had a terrible accident that's affected their gastrointestinal tract that could have come from trauma, perhaps a blood clot that compromised the circulation to the bowel. Sometimes surgeries are done deliberately, such as a bariatric surgery, a weight loss operation that has actually gone too far. The person not only lost their desired weight, but they've kept going and they've reached malnutrition. And then finally, some of our candidates are individuals who've never had surgery involving the GI tract. These might be individuals who have a type of inflammation in the lining of their bowel, such as someone with celiac disease that has not responded to dietary intervention. The assessment of the candidate for intestinal rehabilitation is going to involve multiple key components. Number one, we have to spend time with that individual and learn about their life, learn about their history, learn about the events that brought them to the intestinal rehabilitation service. One of the unique things about intestinal rehabilitation is the fact that each patient is very much unique. Each case is very much its own special problem and set of issues that we have to take care of. Treatment approaches for the person who's going to be working with intestinal rehabilitation are very much personalized. At the core is the ability to bring nutrition back into that person. Sometimes we'll be able to use the gastrointestinal tract, in which case we may need to modify diet. Oftentimes we have to use a route that does not actually involve the gut specifically, but we'll use total parenteral nutrition, a strategy that delivers nutrition via the intravenous route. The treatment approaches are going to also include medication approaches. This is critical for our patients with Crohn's disease, where we have to come up with more effective approaches for the unique individual that we're working with. And then finally, we have a very close working relationship with our surgical colleagues. We have experts in small bowel transplantation, experts in gastrointestinal oncology surgery, colorectal surgery, and we have a very close working relationship with these individuals. Again, the unique individual has the appropriate care plan. Intestinal rehabilitation is a critically important area for patients who've been through a number of problems involving their gastrointestinal tract. If a person has been through a series of operations and things have not gotten better, that person is starting to declare themselves that they're really an appropriate candidate for gastrointestinal rehabilitation. We have a group of individuals who are extremely experienced and comfortable handling patients who've been through very complex problems, individuals who've been through multiple surgeries and have had difficulties, they've had complications, they haven't had the expected healing that was initially anticipated. Because we have an experience and a comfort level dealing with these individuals, we can oftentimes turn that trajectory around and help that person get back on track.